Namaskar दोस्तों, good evening friends. I am Dr. Sanjay Kalia, a friendly and familiar endocrinologist, and you are watching Dr. KK's Med Talks, Mondays with Dr. Sanjay Kalra. आज के हमारे नॉन स्टॉप शो का 1004 1004th एपिसोड है. गर्मी बहुत है. Let's have the headlines for today. Now, researchers from Karolinska Institute in Stockholm, Sweden, have found that abdominal fat in obese men with type 2 diabetes, जो पेट की चर्बी है, that has got higher insulin resistance and different levels of gene expression as compared to men. तो आदमियों में जो पेट की चर्बी है, that is a bit more unhealthy as compared to the abdominal fat of women. From Australia, researchers have shown that men are more prone to have complications of both type 1 and type 2 diabetes. तो आदमी बनना, पुरुष बनना खतरे से और गड़बड़ से खाली नहीं है. But whether men or women, people with diabetes are more prone to heat waves, say experts. So heat से गर्मी से बच के रहना है. In fact, it has been found that high temperatures impact the way insulin is utilized by the body. तो बहुत गर्मी में हमारी जो इंसुलिन है, चाहे टीका बाहर से लगा रहे हैं, चाहे अंदर की अपने पैंक्रियास की हो, this is not utilized properly, and this can lead to fluctuations in glucose levels. Good news is that the diabetes drug metformin has been found to be useful in reducing the risk of a group of blood cancers as well. इतनी सारी न्यूज़ हुई, but let's see what our topic is for today. आज का टॉपिक क्या है? आज का टॉपिक है हीट वेव मैनेजिंग डायबिटीज. हीट वेव एंड डायबिटीज. तो गर्मी बहुत चल रही है. वी वेलकम एवरीवन हु इज लॉग्ड इन टुडे एंड लेट्स आस्क एवरीवन. बिमला कपूर मैडम जी, अमेलिया ब्रायन, हाय. व्हाट्स द टेम्परेचर इन योर सिटी टुडे? व्हाट्स द मैक्सिमम टेम्परेचर? सबको पूछते हैं गर्मी कितनी है आपके यहाँ. हमारे यहाँ इन करनाल वी आर hovering around 45 plus. It is a solid heat wave that's going on and it seems to that it will continue for the next 1 week or so. जो हीट वेव चल रही है इसके बारे में डिस्कशन किया था. हमारे एक्सपर्ट थे डॉक्टर भान, who was with us a couple of weeks ago. He talked to us about the definitions of heat wave and what we can do to protect ourselves from heat. आज हम बात करते हैं about how heat wave affects diabetes, control of diabetes, living with diabetes and how we can protect ourselves. तो अब डायबिटीज तो कॉमन है ही है. जो रिसेंट आंकड़े हैं वो ये दिखाते हैं कि diabetes and dysglycemia put together occur in about 30% of all adult Indians. So that means nearly 1/3 of all adult Indians has dysglycemia. कुछ एक स्टेट्स हैं जैसे गोवा है, वहाँ पे डायबिटीज अकेले ही, not only pre-diabetes but diabetes alone is about 25%. And बिमला कपूर मैडम कहती हैं उनकी सिटी में 43 डिग्री सेंटीग्रेड है. स्वप्ना जी has also joined us. नमस्कार स्वप्ना जी. एंड क्वेश्चन पूछते हैं, how hot is it in your city today? And Amelia is logged in all the way from Ireland. It's hot there as well. So Amelia, you know, India and Ireland, we have so much in common. I am from the state of Haryana, which is in North India. The first Maharaja of Haryana happened to be an Irishman. His name was George Thomas. So what happened? This young, handsome guy came to India to build his fortune. One of our queens took a liking to him, and she gave him the entire area of what is southern Haryana today as land for his kingdom, and he built a palace also. It's called Jahaz Mahal or Ship Palace because it looked like a ship. He ruled over it for about 3 or 4 years. Then, unfortunately, the Britishers caught hold of him, and I think he was being transported somewhere to prison or somewhere by river, and he died of an infection, maybe a gastrointestinal infection. And GI infections are very common in summer here, you know, like you call it Delhi belly. So these infections are quite common. Swapna Jain ji says 42 degrees centigrade. That's also hot. Another similarity that India and Ireland have is in their flag. So the question to everyone is, what are the colors in the flag of Ireland? And then, what are the colors in the flag of India? And then another question will be, what's common? What's the similarity between the Irish and the Indian tricolor? Oh, I get the answer. And then what's the difference? That's the googly. What's the difference in the colors? And yet another similarity between Ireland and India is our constitution. So roughly about one third of our constitution is based upon the Irish constitution directly. That is something that inspired the founding fathers of India when we became independent. So three cheers for Ireland and of course three cheers for India as well. Coming back to our topic, आज की हम बात कर रहे हैं हीट वेव एंड डायबिटीज की. तो होता क्या है, पीपल हु लिव विद डायबिटीज उनको बहुत सारी कॉम्प्लिकेशंस होती हैं. दे हैव लॉट्स ऑफ कॉम्प्लिकेशंस. वन ऑफ देम इज नोन एज ऑटोनॉमिक न्यूरोपैथी. तो ये जो न्यूरोपैथी है इसमें नर्व्स वीक हो जाती हैं एंड नर्व्स वीक होने से जो हमारी सहनशीलता है गर्मी या ठंड के लिए वो भी कभी कभी कम हो जाती है. सो पीपल विद क्रॉनिक complications of diabetes, such as autonomic neuropathy, they may not be able to handle heat as well as others do. So heat tolerance can go down. They may sweat a lot. They may not sweat at all. हो सकता है बहुत पसीना आए, हो सकता है बिल्कुल भी पसीना ना आए. So this can create problems. Another chronic complication is autonomic neuropathy, जिसमें orthostatic hypotension होता है, तो BP कम हो जाता है. So if it's hot, you are sweating a lot, the sodium goes out, you can get a lowering of blood pressure. तो खड़े होके हो सकता है कि बीपी कम हो जाए. So 3 cheers Amelia. And it's possible that when a person living with diabetes stands, the BP comes down, the blood pressure comes down. That can cause giddiness. So that's another complication that can occur in summer. So we've talked about orthostatic hypotension. We've talked about the heat intolerance that may occur. और भी दिखते हैं और प्रॉब्लम्स हैं. तो कई लोगों को हार्ट फेलियर होता है, कईयों को डायबिटिक किडनी डिजीज होती है, नेफ्रोपैथी. सो पीपल विद हार्ट फेलियर, पीपल विद किडनी डिजीज, they have to take good care of their fluid intake. They shouldn't take too much and they shouldn't take too little of water. If they take too little of water, then they get into dehydration. If they take too much of water, they can worsen their heart failure or they can worsen their fluid overload in kidney disease. तो अब ये जो परफेक्ट बैलेंस है इसको हम बोलते हैं गोल्डीलॉक्स जोन. You have to remain within the Goldilocks zone for fluid intake. Whatever your doctor tells you or has told you, let's say in January or February during winter, it may have been correct for that time and it may not be correct for now. So how do you go about this? अगर confused हैं तो डॉक्टर से बात करें, उनसे मिलें और सवाल पूछें. Especially if you're a heart or a kidney doctor, reach out a patient, reach out to your doctor. Second thing is you monitor your urine quantity and urine color. If your urine color has become very dark, it's high colored, it means you have taken less water over the last 6 or 12 hours. So we need to increase our fluid intake. On the other hand, if your urine is clear colored and is coming in good amounts, then that means you are well hydrated. So this is something that will help you decide whether you've taken enough water or not. The second thing is to feel your own body. It's hot outside, everyone is sweating, but your body is dry. Even your axilla, the area under the armpit, that is dry. That means there's not enough water in the body, so we need to drink more. So these are simple ways of figuring out whether you're taking enough water or not. Amelia is living with type 2 diabetes, and the best part actually about fighting type 2 diabetes is that you can do that. And all you need to know is to learn a lot. And this is something that continues throughout life. Ali Nazakat साहब भी हमको good evening करते हैं. Warm welcome, sir. And the question, Nazakat ji, is आपके शहर में कितनी गर्मी है? What's the maximum temperature today? So we are talking about the challenges that people with diabetes face. Those with chronic complications, they can have low BP. They might have heat intolerance. They have to figure out their water intake. Otherwise, they'll get into dehydration. और चीजें भी हैं, गर्मी की वजह से इन्फेक्शन ज्यादा होती है. So in the hot summer months, you might get skin disease. We have to take care of that. If you begin scratching yourself, the skin disease can worsen. You might get more infections. So again, we need to take care of that. Another thing that can occur is stomach infections. Stomach infections may occur because of food poisoning, water poisoning. One common reason that I have seen in my part of the country is लोग खरबूजा या तरबूज खाते हैं, सुबह काटते हैं और रात को खाते हैं. So one common reason that we've seen is people cut the watermelon or muskmelon in the morning And then the watermelons are big in size. They are so sweet and juicy. So maybe you bought a 7 kg watermelon and it doesn't finish for 12 hours, 24 hours, 48 hours. There are just 2 or 3 people at home. And then when you eat the old watermelon, that might get infected because there's such high water content. तो उससे भी फूड पॉइजनिंग हो सकती है. उसका इलाज ये है कि जब भी आप खरबूजा या तरबूज काटें, कम काटें. And if you happen to cut a big watermelon and there are not enough people at home, why don't you gift it to your neighbor or your friends? Don't keep it stored for a long period of time. It's also a good idea to take care of your electricity and refrigerator. गर्मी है, लाइट चली गई, फ्रिज बंद हो गया, गलती से बंद हो गया, तो भी गड़बड़ हो सकती है. So take care of your refrigeration and don't overload your fridge in this season. The fridge is also, it's not a human being, but it's a machine. The more hot things you put in your fridge, the tougher it is for it to maintain temperature. So keep less things in the refrigerator and buy fresh from whatever shop. Shop की बात करते हैं, so even the shopkeepers have to take care of their refrigeration. So let's say you go out to buy ice cream. Now you've bought frozen ice cream, but are you sure that it has remained frozen with the shopkeeper? Was the cold chain maintained? Have there been frequent episodes of freezing and thawing? हो सकता है राइट को चली गई, शॉपकीपर भाई साहब ने जनरेटर नहीं चलाया क्योंकि वो थे नहीं वहां पे. और हमारे एनसीआर में तो कानून भी बहुत हैं इसके डिफरेंट. हमारे ये जो हमारे जो बिजली के जनरेटर होते हैं उनके. सो वी नीड टू फिक्स अप दैट, वी नीड टू बी श्योर अबाउट दैट एंड बाय फ्रोजन डेजर्ट्स or frozen milk only from shops where you are certain that 24-hour electricity backup is there. Thanks Amelia for being with us. अलीन साकिर जी को भी थैंक यू करते हैं. अरुणा त्यागी मैडम भी हमारे साथ लॉग्ड इन है. तो अब हम बात कर रहे हैं शुगर एंड हीट वेव की. तो एक तो कॉम्प्लिकेशंस हुई, chronic vascular complications. Second, comorbid conditions like kidney disease, fluid overload, heart failure. You have to make sure that you take the right fluids. Third, infections, skin infections and stomach infections or gastrointestinal infections. Yeah. These are some of the challenges that we face. More challenges for people living with diabetes. Supposing someone is on insulin, and Rakesh Soni ji को जो leading सोसाइटी मेंबर हैं फ्रॉम करनाल इन हरियाणा, इनको वेलकम करते हैं. इंसुलिन जब लेते हैं तो इंसुलिन को सही टेम्परेचर पे स्टोर करना होता है. नाउ यू कैन कीप योर इंसुलिन पेन्स फॉर अप टू 28 days एट रूम टेम्परेचर, बट जिसने भी ये लिखा किताब में उन्होंने 48 डिग्रीज या 47 डिग्रीज टेम्परेचर नहीं देखा था. शरद चिकारा जी को भी नमस्कार करते हैं. नमस्कार चिकारा साहब. सो द इंसुलिन दैट यू स्टोर, एक तो बाय लेस इंसुलिन एट अ टाइम, डोंट बाय 5 or 10 vials टुगेदर. Do not freeze them. Do not keep them out in the sun. And if you're keeping them indoors, preferably keep them in the fridge. But if you, let's say you don't have a refrigerator, don't keep them directly in front of a window where sunlight comes in. Keep it in a cool, dark place. Maybe in your drawer, in the drawer of your table. So you have to store insulin properly. क्योंकि क्या होता है कि जब गर्मी बहुत ज्यादा होती है तो इंसुलिन की जो फार्माकोकाइनेटिक्स है वो भी बदल जाती है, तो बॉडी को ज्यादा इंसुलिन की कभी कभी जरूरत पड़ती है. तो ये सब चैलेंजेस हैं. इवन फॉर टैबलेट्स, वी अज्यूम दैट टैबलेट्स कैन बी स्टोर्ड एट एनी टेम्परेचर, बट आप ध्यान से देखें उस पर भी एक रेंज है टेम्परेचर की. सो टैबलेट्स शुड आल्सो बी स्टोर्ड इन अ कूल प्लेस, नीदर वेरी हॉट नॉर वेरी कोल्ड. कुछ एक दवाइयां हैं नॉट फॉर डायबिटीज बट डायबिटीज मेलाइटिस, बट देयर इज अ डिजीज कॉल्ड डायबिटीज इंसिपिडिस. इसमें जो टैबलेट आती है, मिनिरिन टैबलेट है, वो इतनी टेम्परेचर सेंसिटिव है कि आप गर्मी में बाहर रखेंगे तो वो गोली उड़ जाएगी. सो इट्स पॉसिबल यू लीव अ टैबलेट ऑफ बॉटल ऑफ मिनिरिन आउट इन द सन, and then after a few hours when you go there's nothing left because the tablets have kind of just evaporated. Manasa Thapa ji हैं from Nepal. Warm welcome, Manas ji, and it's good to be with you. And we welcome our expert, Mr. S.C. Bhan from the India Meteorological Department, New Delhi. Sir is an expert in heat wave and heat wave management. So it's a matter of pride for us कि भान साहब हमारे साथ हैं आज. Summer also makes you tired. So whether it's summer or winter, people get tired, people with diabetes. So इसको बोलते हैं हम diabetes fatigue syndrome. People remain tired all the time. Now, a lemon a day keeps the doctor away. A lemon a day keeps fatigue away. So let's look at what lemon means. First of all, from a heat wave point of view, it actually means lemon and lemonade. हिंदी में यदि आपको लगता है या नेपाली में आपको लगता है कि किसी ने आपका नींबू निचोड़ दिया है. In English, if you feel that somebody has just squeezed you out, there's nothing left in you. What your body is telling you is, I need more water and I need more salt. So the best treatment would be a lemonade. Lots of lemon, reasonable amount of salt, lots of water, and if you're diabetic, no sugar. So lemonade. For the heat wave, lemonade के और भी options हैं. So we have lots and lots of other options. Jaljeera, nimbu pani, nariyal pani or coconut water. If you have kidney disease, speak with your doctor first. If you have high potassium, coconut water is a big no. Do not take it at all if your potassium is high. If your kidneys and potassium are fine, you can take a nariyal pani or coconut water every now and then. Depends upon which part of the country you are in. If you are where Sapna ji is, then it's relatively economical. And if you live where I am or where Manas lives, then coconut water is a bit expensive also. So the lemonade would be a good idea. Jaljeera is an Indian spice. You can try that. It's meant for summer. Other things like kokum juice, which comes from our Konkan coast, from Goa. Kokum juice is a very refreshing drink. Sattu from North India. Sattu is a drink or a gruel made with chana or with gram flour. And the All India favorites, lassi, chaj, buttermilk. So lemonade, buttermilk, jaljeera, kokum juice, these are things that we can take. Barley water is a great idea because that gives you hydration and nutrition both together. It also gives us sense of satiety. So barley water is a great thing to have. Some contraindications for barley water. यदि आप हाइपोथायरॉयड हैं, इफ यू आर हाइपोथायरॉयड एंड आप सुबह थायराइड की गोली खाते हैं, तो उससे 1 घंटा 2 घंटा आगे पीछे बार्ले वाटर या जौ का पानी ना पिए. डू नॉट टेक बार्ले वाटर along with your thyroid tablet or 1 or 2 hours before or after that, because otherwise the jaw that will prevent the thyroid tablet from being absorbed. Another contraindication, semaglutide. If you're taking semaglutide tablet for diabetes, then that should be taken with 100 ml of water 30 to 60 minutes before meal. So try to avoid taking barley or barley water near the semaglutide tablet time of administration. That will also prevent the absorption of semaglutide. And the third contraindication is people with celiac disease or with gluten intolerance or gluten allergy or wheat allergy. तो यदि किसी ने आपको कह रखा है कि गेहूं नहीं खाना क्योंकि आपको गेहूं की एलर्जी है, if you have been told by your doctor that you should avoid wheat, तो wheat और जौ दोनों में, wheat and barley दोनों में एक ही प्रोटीन होता है, which is the gluten protein. So these are a few contraindications. Otherwise, barley water would be a great thing for summer and even otherwise as well. तो अब हम बात कर रहे थे about lemon. So first of all was the lemonade part. But another concept of lemon is, and this is what Amelia has asked us, how do I manage my diabetes fatigue? So L stands for lifestyle. E stands for endocrine. M for metabolic and medical. O for other and orthotic, and N for nutritional. So let's do this one by one. A lemon a day keeps fatigue away. L for lifestyle. Make sure that you are active. Sometimes what happens, we become so tired, we become so lazy, and we just stop exercising. We become physically unfit, unconditioned. So poor physical conditioning is a common cause of poor energy. The only treatment is to get out of your sofa, get out of your home, begin walking, begin exercising. So sit instead of reclining, stand instead of sitting, walk instead of standing, and run instead of walking. And even if you do for 1 or 2 or 3 minutes a day, that is also an improvement. So every few minutes that you get, you begin doing that. So for example, we are all on KK Talks today. So I'm standing, most of us would be sitting. Now, what is there to prevent me from stamping on my feet? So let me sort of, begin doing this. So see what I'm doing? I'm just walking on the spot. And this is much better than standing. So L for lifestyle, that is physical activity is important. The other thing in lifestyle would be stress management and sleep hygiene. So make sure that you get enough sleep. Otherwise, you will remain tired during the daytime. You may say that you sleep well. Do you snore or not? So ask your partner, do I snore at night? Snoring can be a sign of obstructive sleep apnea. And that means you are getting less oxygen at night. So your brain gets tired, and then your brain wants to sleep during the daytime so that it can get enough oxygen and rest. E is for endocrine. So the common causes of poor energy would be maybe menopause, hypothyroid. These are two common causes that we have to rule out. Usually, your doctor will take a thyroid test, and menopause you can get to know according to the phase of life that you are in. Menopause is a word that's used in women. Andropause or late onset hypogonadism, LOH, is a word that is not used so frequently in men, but men also have this phase of life. So if you're male in mid age, even it can be 30, 35 years, and you're feeling a bit lazy, talk to your doctor. Do you think I should get a serum testosterone test done or not? The doctor will ask you a few questions and will give you the right answer. So E is for endocrine, thyroid, menopause, andropause. The right phrase for andropause is late onset hypogonadism. M would be for medical and metabolic. So maybe anemia, that would be the commonest in India. Low hemoglobin. So think about that. And then the liver, kidney, heart test, these should be done. Heart failure. Now, don't feel afraid when you hear this word heart failure. It doesn't mean that the heart is about to fail, but this is again something common, and they'll check your blood pressure. They might do an echo. They might do a test called NT-proBNP, NT-proBNP, and that will help us give the right therapy. Now, if we are not sleeping well, then the treatment is sleep hygiene. And Amelia, the term that we use here is sleep stewardship. So you're stewards of your own sleep. And if we sleep at the right time, in the right manner, take dinner 2 or 3 hours before going to bed, stop your screens half an hour before going to bed, actually the quality of sleep will go up. You might wish to take a comfort drink, a comfort beverage at night. In India, that would be haldi wala doodh or turmeric milk. So in Ireland also, you may get turmeric milk or you can get turmeric spice. In the UK and in Ireland and in Western Europe, the comfort drink will be chamomile tea. So chamomile is a comfort drink that you can have at night that will help you improve the quality of sleep. And over-the-counter preparation is melatonin. So see if you need that, speak with your doctor about that. But chamomile and turmeric milk, these are things you can try. A comfort spice or a comfort food that you can take is cashew nuts, because cashew nuts are rich in an amino acid called tryptophan, which breaks down into serotonin, which makes us happy. And we are happy to see Natasha with us. So, Natasha, the question to you is, how hot is your city today? What's the temperature? We are speaking about a lemon a day keeps the doctor and keeps fatigue away. L was for lifestyle, including structured physical activity, sleep hygiene, and stress management. E is for endocrine, menopause, andropause, thyroid. M is for metabolic and medical, like anemia, heart disease, kidney disease, liver disease. Natasha is from Florida, so it's good to see you, Florida, and that is a hot state of the US. Okay, and Manas says about dairy products. No, in diabetes you can. So what we would say, if I shift to Hindi, ghee, makhan, malai, na leं. So do not take clarified butter or cream. Avoid these. कच्चा पनीर लिमिट में ले लें. You can take cheese, cottage cheese within limits. दूध, दही, लस्सी, रायता जितना मर्जी ले लें. So curd, buttermilk, and now I don't know the English for raita. Would it be hung curd? I'm not very sure. So maybe Natasha can help us, or maybe Manas can help us. She's very good at nutrition. So dahi, lassi, raita jitna marji le लें, and दूध बगैर cream के, without cream. So you can take toned or double toned milk. So this is the general advice that we give. It also depends which part of the country you're living in. So like in my state, our proteins come only from dairy products. So if we were to stop milk in our patients, there would be no source of protein left. Other places where more of non-vegetarian food or eggs are taken, perhaps you can stop dairy products or reduce the intake without impacting protein health. So it will depend upon the overall diet of the patient. गुरविंदर जी को भी हेलो कहते हैं. Hi Gurvinder for being with us, and it's good to see trans oceanic and transcontinental friendships coming up. So Natasha and Amelia, it's good to see you all together. So Natasha was told that she has pre-diabetes, so she should not drink sweet juices, which is correct. Don't take them. But yesterday you woke up and the glucose dropped. It was strange. So yeah, the body responds in different ways. One of the treatments of pre-diabetes is a 3+3 meal pattern. This means 3 major meals and 3 minor meals or 3 snacks. So do take something, maybe a glass of milk or something before going to bed at night, and don't sort of fast for long periods of time. A 3+3 meal pattern, regular meals and beverages, helps us fight the heat wave as well, because it keeps the electrolytes and the fluid balance in an optimal range, and that Goldilocks range, what we spoke about. Coming back to our lemon, M for metabolic and medical, O is for other things. So other would be iatrogenic or drug induced. So for example, it's possible that for blood pressure, you are taking a diuretic, a drug which causes increase in urine production. The urine is fine, but all the sodium also goes out, the salt goes out with the urine, so you get tired. Another drug that can cause fatigue is beta blocker, which is also used for blood pressure and for heart failure. Statins, which are drugs used for cholesterol, if you take it in a high dose, they can also cause fatigue. So drugs can also cause easy fatigability. So talk to your doctor once more and look at the list of drugs. The last one, N in lemon, is the most important. N is for nutrition, and that's what we are speaking about today. So first of all, make sure that your macronutrients are fine. That is carbohydrate, fat, and protein. In South India, South Asia, the biggest challenge is protein insufficiency. So we need to increase our protein intake. Micronutrients. So let's look at micronutrients. First is minerals like iron and calcium. So iron deficiency, calcium deficiency, extremely common across the world. So get your levels checked. It is possible that your hemoglobin may be normal, but iron may be low. Even then we need to take iron. It can be a tablet or it can be an injection, whatever is recommended. Calcium may be okay in the blood, but maybe low in the bones. So menopause onwards, for example, everyone should take calcium. So these are minerals. The second type of micronutrient is vitamins. So vitamin D, vitamin B, these deficiencies are very common. You can take a multivitamin. Take a proper dose of vitamin D, which is a bit higher in South Asia as compared to the rest of the world. We would suggest 60,000 units once a week for everyone for about 3 months, and then maintenance of once a fortnight or once in 30 days. So vitamin D, when you supplement, then the fatigue goes away actually. So first we had macronutrients, 3 types: proteins, fats, carbohydrates. Then we have micronutrients, 3 types: minerals, vitamins, and the third is electrolytes, sodium, potassium. So in summer, actually you have to take care of your electrolytes. पानी खूब पिए, नींबू पानी, जलजीरा, गोलगप्पे वाला पानी अगर साफ हो तो you be sure of hygiene when you're taking street foods. Thanks to Natasha for being with us. In nutrition, we have another thing, and you speak about antioxidants and antitoxins. So this is a gray zone of research. Antioxidants हैं जो anti-aging का काम करते हैं. So you can take resveratrol, and you can take certain vitamins which help in reducing the oxidant stress. कई लोग टेस्ट करवाते हैं जिसमें आता है कि उनके पानी में बहुत ज़्यादा लिथियम या बोरॉन है, तो उसका भी देखना होता है. You shouldn't have too much of toxins in your water or in your food. If iron tablets don't suit, it's actually tough. So try to change the brand, or take a brand that is made for children. You can take a syrup, an iron syrup, which is meant for younger children. If even that doesn't work, we can give you an injection. One injection will last 1 year. तो एक इंजेक्शन लें, उसका 1 साल तक आयरन का बैलेंस और वो बना रहता है गुरविंदर जी. और बच्चों वाला भी ट्राई कर सकते हैं सिर्फ. या फॉर विटामिन डी, 60,000 units once a week for 3 months, like Manas says. And for people with diabetes, this is actually advisable. In fact, more strongly advisable. So for Nepal and India, the dose will be 60,000 units once a week for about 3 months. And then you can give a maintenance of once in 15 days or once in 30 days. Dr. Bhan asks about turmeric milk before going to bed. Yes, sir. Milk actually gives a sense of comfort and helps you sleep well. Other summer drinks like lassi, coconut water, lemonade, sattu, any time of the day, sir. And preferably 3 plus 3 meal pattern, which would mean small frequent amounts throughout the day. Dietary food for breakfast, Amelia. So what is? How do we decide what food? It should be adequate. You shouldn't go hungry throughout the day. You should have adequate macronutrients, adequate micronutrients. So the trick is you look at the flag of Ireland. Now, how many colors are there? Three. If you're a patriotic Irish, your breakfast plate should have at least three colors. Supposing you have a monochromatic breakfast plate, you understand, like you have only potatoes or you have only eggs. That's a single color. That is not a balanced diet. So we need multiple colors in our plate. It can be more than three, it can be five or six as well, but you get the point. And this is how you can convince children also to take different types of foods at breakfast. So it should be adequate in terms of macro and micronutrition. It shouldn't be so adequate that the glucose levels go up. So the glycemic index should be low. And the third is it should be easy to prepare because the person who's preparing the food, we have to think about that as well. सो गुरविंदर जी का एक क्वेश्चन लेता हूँ शुगर फ्री सिरप नहीं आयरन का नहीं आएगा देन वी जस्ट कीप ऑन चेंजिंग द कंपनीज we have now nano formulation of iron nano formulations speak with your doctor like some brands are Raricap, Vitcofol, HB, so try these, otherwise we can give the injection also. Coming back to the breakfast food, so the so see how you say it. First you should take fluid and fiber. In Hindi, पहले पानी और पत्ता. Patta would mean leaf or fiber. Okay. So first fluid and fiber. So you can begin with a glass of lemonade or maybe buttermilk. That will give you satiety. The fiber you can get from maybe fruits or you can get from green vegetables, whatever is available. फिर प्रथम protein. Primacy for protein. From Amelia's perspective, the protein can come from eggs, from boiled eggs, and you can take both yellow and white part of the egg. Don't worry about eating the egg. So maybe two eggs, you can take them boiled. If you want to take them scrambled or fried or an omelette, just minimize the amount of oil that you use while cooking. Just don't make it zero, just minimize the amount of oil that you're using. So that's protein. And along with that, now we need carbohydrate and we need fiber. So maybe bread, brown bread would be better than the white bread. In India, you can have a chapati, a coarse chapati from Manas. My favorite Nepalese cuisine is the Nepali sag and the dudo. So that is a dough. It's made of. I may not be right in English, but Manas is there, so she'll help us. So the dugdo, that is it's like a brownish kind of a thing. It's made of buckwheat. Yeah, now I remember the English. So it's a buckwheat dish and the Nepalese sag. This would be a perfect breakfast. You're getting lots of fiber, lots of minerals. There's no protein in this. There's not adequate protein in the buckwheat plus sag, so you would have to add an egg or something for that to get the protein. And that would be a great breakfast to start with. The bad breakfast, Amelia, would be cornflakes. So it is made of maize, and people sell it saying that it's very healthy, but actually cornflakes have a high glycemic index, so they'll put us in trouble. You can saute some green vegetables if that's easy. So just sauteed green vegetables or microwaved or boiled, that would also help. Okay, so Gurvinder asking for brand names. Let me get them written for you. Though ideally we avoid brand names, but I am writing two brand names, and we'll ask Faraz. Faraz is with us backstage. He'll put them in the comment box for you. Gurinder Kaurji, just give us a minute or so. Faraz will put them for you. And Manas, thank you. Yeah. Okay. So yeah, I was partly correct. So Dido made of buckwheat or maize flour. Manas, this is my favorite in Nepal. So whenever I go, I like eating this. And I wish you could share the recipe sometimes with Amelia, but Amelia, it's difficult to make. You need an expert cook. So this is what we had to speak about today. We've spoken about the heat wave. It is hot across the world, and global warming is coming up in such a way that it's going to become hotter and hotter. We talked about the challenges that people with diabetes face, and we've talked about how you can manage them. And porridge is very good, yeah, Amelia. Porridge with almond milk would be a great idea to begin the day with. A great idea. Add an egg if possible to the porridge. I mean, along with the porridge. And remember the flag and the three colors. The Indian flag has four colors. We have the same tricolor as Ireland, and then we have a chakra in the middle, which is light blue color. So that's the fourth color. With this, I'd like to thank everyone who has been with us today. It's been great having you. And like I said earlier in the program, we have crossed 1,000 talk shows. So that's a great number to be, but 2,000 is even greater. So that's where we'll aim for 2,000. We have Faraz with us backstage. Now, Faraz lives in Patna, I think, where there is a heat wave going on. So, Faraz, आपने आज क्या सीखा बताओ के में टॉक में?
थैंक यू सो मच सर, फिर से आपने मौका दिया इस शो में. एज वी नो दैट लाइक पटना हैज़ वेरी large amount of heat sir, like during the summer season. And also the thing is that this year we are experiencing humidity also, like as West Bengal, Kolkata, like weather are humid level, that is it is located near the sea. But Patna is also having humidity climate. So the thing is that we have to be hydrate and keep yourself hydrate, जिससे सर हमारे पे बॉडी का जो वाटर लेवल हो कम ना हो, और अच्छा फ्रूट्स का सेवन करना है सर. और इसी के साथ साथ हम इस हीट वेव में अच्छे से रह पाएंगे सर.
Thank you so much, Faraz. So, plenty of water, remain hydrated, and take fresh fruits. And we welcome Dr. Noor Aga Danish from Kabul in Afghanistan. Salam, Dr. Today we were speaking about heat wave. अफगानिस्तान के कुछ एक जिलों में बाढ़ आ गई, फ्लड्स आ गए, so that is another problem. And I think it reminds all of us that we have to work together as humanity to fight the global warming in whatever way possible. तो अपना अपना हम बिट करें, कोशिश करें ताकि ग्लोबल वार्मिंग कम हो और गर्मी कम हो. With this, I'd like to thank everyone for having been with us today. सबको शुक्रिया, धन्यवाद, मेहरबानी, and सबका भला हो. जय हिंद.
थैंक यू सो मच सर, वी आर क्लोजिंग फॉर टुडे.